When it comes to pain, all of us have experienced it. But for many people, chronic pain is something they suffer with each and every day. Welcome back to Get Connected. I'm your host, Con Jackson. We're coming to you from Prague, and behind me is the famous Prague Castle, and we'll discover that in a moment. But just being here in Prague, being on vacation, can alleviate some of the pain. But what if you have chronic pain? Well, two lovely ladies join us now. Mikkel and Lynn join us from the States. Welcome to Get Connected.
Hi, Con.
Hello, Con.
Well, ladies, thanks for joining me here in Prague in the Czech Republic.
Wow,
Oh,
one of my
excellent.
favorite cities.
Well, we're filming a great show, but I didn't want to miss out on the opportunity to have a chance to interview you both. And Lynn, let's start with you. Tell me what symptoms you were experiencing that led you to the diagnosis of fibromyalgia.
Well, I had surgery, and like many people with fibromyalgia, oftentimes something traumatic can trigger the illness, a car accident, childbirth, a long illness. And all of a sudden, after my surgery, I started having all of these symptoms that we refer to as fibromyalgia. Widespread pain throughout my entire body, the inability to fall asleep and stay asleep, cognitive problems. And it just came on me so quickly. I had such a hard time understanding what was going on. And I actually went and saw over 37 doctors over a 2-year period before I ever heard the word fibromyalgia. And it was so frustrating because I knew something was wrong, but no one could tell me what was happening. And when I finally learned that it was fibromyalgia and found a healthcare provider who was willing to work with me, it made such a big difference, because then I felt like I could eventually get better, and that's what did happen.
I think that's why it's so important that the Faces of Fibromyalgia Educational Initiative has been launched. This is providing us information that we're posting on fibrocenter.com that is giving us more information not only about fibromyalgia, better understanding so people can become more informed, but we also have a new survey by people who are either diagnosed with fibromyalgia or living with a painful condition that could be fibromyalgia, and they're telling us how their life is being impacted and changed by this condition. It is very profound to know that overwhelmingly 9 out of 10 who responded stated that they no longer feel like they're the person they used to be before they ever had pain, and that it is impacting their ability to make major life decisions, what kind of relationships they can have and at what level, what kind of job they can continue to do or have to give up, you know, and then what kind of how is this impacting their family life, including are they going to have children if they haven't been having children yet, or what kind of parent they can and cannot be. And I think Lynn can give you some excellent examples of the decisions that she had to make because of fibromyalgia.
Well, when I was very first dealing with the symptoms, I kept thinking that it was going to go away. And unfortunately, fibromyalgia is a chronic illness, and so it does last throughout your life until we hopefully find a cure someday. But I had to make decisions. I had to give up my job. I was in advertising. I had my own agency, and so that affected a lot of people. My husband and I decided not to have children because I was afraid that I wouldn't be able to care for the baby and the child the way I would want to. We ended up moving because we felt that my health was better in a different climate. So there's all sorts of things that were major, major decisions that we made based on the fact that I had fibromyalgia. And I don't think people understand it's not only the pain and the suffering, but it's all the other aspects of your life. You just don't feel like the same person that you were before you became ill.
And unfortunately, as a pain management nurse, I hear this story over and over and over again, how their lives are being devastated. I think we really need to pay attention to this disorder. I would love to challenge our healthcare professionals as well as our researchers to continue to get more work and more information about what is causing this neurological painful condition, so that not only we can get better treatments, but hopefully eventually we might even be able to find a cure.
Mikkel, how can family and friends be most supportive of someone that's given this diagnosis?
You know, it's really interesting because I do believe that that is one of the most important things to help you feel better. I know that oftentimes when you're in pain and you're miserable, you kind of become whiny and complaining, and oftentimes that turns off people. It makes them not want to be supportive. And so I learned different things, and my husband and I worked where I would do a little, in the morning, a little story for him, and I would say, today it feels like I was kicked by 10 horses, which would mean my pain hurt, but it wasn't bad. Or if I would say my pain is like 100 horses, we would know then that that day I wasn't going to be going out and doing anything. But I wasn't complaining, and we would kind of, he'd say, well, how many horses today? And that way we could communicate without making it something that was really negative. And I think that if you do adapt, if you do learn how to let your partner or your friends or your family know where you are, they can be more sensitive, and that helps so much.
I want to tell you an interesting story, Con. I have a neighbor right now who is living with fibromyalgia. It took her a couple months before she told me really what was going on, before she told me she was having trouble with depression. When she told me she was getting a diagnosis of fibromyalgia, I then took the next step and provided her direct information from the American Pain Foundation. And I said, see if this information will help you. She read it. Not only did she thank me, but then she shared it with her family members, and she was able to have a better conversation with her healthcare provider. And her and I check in every once in a while. I don't like to overstep my bounds, but I do say, how are you doing? Are you sleeping? Let me know if there's anything I can do to help. And I think that makes a really big difference, because oftentimes people living with pain feel very isolated, they feel ashamed, they feel stigmatized from our society. And I think it's an opportunity for us as neighbors and friends and loved ones to reach out and be understanding. Because I can't imagine, I don't know if you can, what it's like to get up every day living with pain, only to go to bed at night still with pain.
Mikkel, if someone is experiencing this type of chronic pain, what specialist is out there for them to see?
Well, it's very important that you see a healthcare provider who's knowledgeable about fibromyalgia. That may be your family practice doctor, it may be a specialist like a rheumatologist, but I think it's very important that you check with that healthcare provider and find out if they do treat fibromyalgia and how many patients they have, because there are doctors who are more interested and more knowledgeable. And just like you would interview an attorney or an architect, I think it's important that you interview your healthcare provider to make sure that they are going to be the best one to help you. And with continuing medical education, there are more and more healthcare providers who do understand this illness and do want to help and treat patients. So just make sure you get to someone who is already treating patients with fibromyalgia.
And I think it's important also to know, Con, that you expect to have a team of people working with you. Not only your family and your friends who are close to you, but it may be a variety of healthcare professionals. Your primary care, you may be seeing a specialist like a rheumatologist or a pain management specialist. You may be working with physical therapy. You may be working with complementary therapists, for example. And you may be taking a combination of medications and non-medication therapies of building, that is a treatment plan that's comprehensive, that fits you as an individual.
What's a great resource for us to learn more on what we discussed today?
Well, you can go to fibrocenter.com as a first step. That'll help provide you more information about fibromyalgia. It'll give you more information about the survey we were discussing with you today. It also gives you access to both of our organizations, the National Fibromyalgia Association as well as the American Pain Foundation. So that'll be a good start. Number one, if you're somebody that's living with pain, speak up, speak out, get informed, and then go to your healthcare provider and start having those critical conversations so you can get your life back.
If you want to learn about other Health Beat segments we've done on Get Connected, log on to our Get Connected website at contv.com. Well, I'll tell you one thing, the castle awaits us. We are here, and we're going to be treated like royalty when we come back to Prague in the Czech Republic. See you in a minute.